The mission of CIMH is to do research, training that informs policy and system change to increase access and quality of services for those who are often left out. And we do this locally, and we also do this globally.
The Center for Innovation in Mental Health is multiple things. One is that community partnership in where we understand the citizens in whatever city or locality we work with as partners in A, their understanding of what is going on, the challenges and their needs, and B, to bring and work with the organizations to work towards the goal of bettering the mental health of the communities.
A lot of our projects are using a model that is preventative. So we're trying to increase people's awareness and education about mild and moderate mental health concerns so that we can address those early and we don't have to wait until they get to that crisis level to allow there to be resources for those.
Historically, mental health was thought as of a clinical problem. You will have the patient and you will be addressed one-on-one or in small groups. Now we have come to realize that mental health is a major public health problem.
I work very closely with the center on a mental health initiative called Harlem Strong. It is a research project, first and foremost, but it has some really interesting and very supportive mechanisms in place that do task sharing with community health workers. Things like mental health still carry a stigma, even though we try to address it from a positive perspective, that people still feel like, oh, that's not me. I don't need medication. I don't need therapy. I don't need support. I could just be resilient. And I think the uniqueness of this center gives us an opportunity to sort of peel the onion back.
We work with a variety of different settings like housing, primary care, community-based organizations, faith-based organizations to integrate mental health support services into the work that they do. And that's what we call mental health task sharing. And it's just a way of simplifying and making mental health services much more accessible.
There's a whole bunch of ways that individuals and communities can get involved. We often do these community-based stakeholder meetings where we invite people who are part of the communities that we're serving to tell us about what they want and try to incorporate their ideas into our projects.
During the course of our research, I have come to appreciate the importance of mental health for people who struggle with substance use, especially among young people, given the enormous challenges that they face. So I hope my vision is to contribute to that critical bridge between mental health and substance use and not keeping it as a separate track.
What I hope to see in the field of mental health is that there will be more and more people who can be mental health champions and that they have the skills to support folks, so that we increase access to folks who can help.
We really want to raise awareness, address the stigma of mental health, but most of all, be able to provide and support the community in developing interventions that are homegrown in our community, but are science-based.